I'm Dr. Cathleen Simeo from Hearing Solution Centers. One of the biggest misconceptions that people have about hearing aids is that it's an instant fix. They think that as soon as you put the hearing aid on, everything should be perfect. But that could actually not be further from the truth. When we deal with patients with hearing loss, oftentimes they have had years with a problem. And when we work with anything like that, that problem builds up over time, and all of a sudden putting hearing aids on can be quite a shock to many people. Some of the first things that most people experience, the very first thing that they'll notice is that their voice sounds so much louder. I'm sure many of you have heard someone who had a hearing loss and they yell really loud or they talk very loudly. That's because we monitor our own voice through our hearing. If you're not hearing as well, then you will speak louder. And so putting those hearing aids on someone makes their own voice seem quite a bit louder. You may also notice that there's a lot of sounds in the environment that you had forgotten about. Something as simple as footsteps or the keyboard. Any sounds like that can be very annoying for many patients at first. But over time, as the brain adjusts to a lot of these little sounds, it just becomes the new normal again. And that's something that oftentimes people will experience. Hearing aids, when we first start out, are set based on an average setting based on your hearing loss. However, if one person and let's say their wife both have the exact same hearing loss, they're going to want things set differently because their brains process that sound differently. And so generally what we see is it takes anywhere from 3 to 5 different appointments for a patient to come back in after they've experienced a sound to let the audiologist make changes to the hearing aid to make it sound the way that it should in those different environments. One of the other things that we often tell our patients is that hearing aids are little machines, and as we wear them every day and through all types of weather and all types of situations, they do take constant maintenance. Oftentimes with our patients, after we get them through the basic adjustment period, we do recommend that patients come back in about once every 6 months to get the hearing aids cleaned and to make sure everything's okay. By doing that regular maintenance, we're going to ensure that the hearing aids last and that they hold their value over time. And then the number one thing that I always recommend for all of my patients is to be very patient and be consistent. The more consistent you are in wearing the hearing aids, as in you wake up in the morning and you put them on and you do not take them off until you go to bed at night, that's going to ensure the best success with hearing aids. Hearing aids, just like any other skill, take practice. And the more you practice, the better you'll be.